Hi, my name's Jamie Wood and I'm a physiotherapist from Perth in Western Australia. Today I'm making a video for the Precision Recovery Initiative at Mount Sinai Hospital regarding how to do a really easy airway clearance technique at home, which is commonly known as the active cycle of breathing techniques. So today for you I'm going to teach Sam how to do this technique. It's a very easy to learn technique that you can do independently at home. You can do it sitting like we will go through today. You can do it half lying back in bed or lying horizontal on your side in a comfortable position. The active cycle of breathing techniques consists of three components, which are breathing control or taking a rest with nice relaxed breathing, deep breathing exercises, which we refer to as thoracic expansion exercises, and then the forced expiration technique, which involves huffing and then a cough to clear your secretions right at the end. So Sam, I'll just talk you through how to do this. So breathing control essentially means taking a rest to let all of your breathing muscles settle down. So you should have no breathing through your upper chest, and you should just feel the lower part of your rib cage gently rising and falling. And why this is important is that the other components of the technique might make you breathless or lightheaded. So you use breathing control to take a break in between each of the other components as we go. This might only take a few seconds, or if you're more breathless, it might take up to 30 seconds or even a minute at each time. Sam, the next component is the deep breathing exercises, and these are a deep breath in through your nose if you can, all the way in to fill up your lungs, pausing at the top of the breath in for 3 seconds, and then relaxing and letting the air out. So I'll get you to do 5 of those. Nice and slow. Good, and remember to pause at the top for 3 seconds. So doing deep breathing helps to get air behind any obstructed airways, starts moving the secretions, and the pause at the top for 3 seconds is especially important as that allows air to travel around through your smaller airways and alveoli or your air sacs to get air behind obstructions. It's important to breathe in slowly, and after pausing for 3 seconds, when you relax, the natural elastic recoil of your lungs pushes air out faster, which creates turbulence to help shear secretions off the airway walls. So after you've done 5, Sam, take a break. You may modify this if doing deep breathing makes you lightheaded, so you could stop at 3 or 4 if needed. Now Sam, when you're ready, I'll get you to do a second set of 5 deep breaths. So if you can, doing a second set of deep breathing is good because it allows you to start moving more and more secretions higher up in your airways so that when you do your huffing and a cough, it's much more effective. I'll also at this point encourage you to never lay down in a head down tilt position or what was previously known as tipping. This can exacerbate gastroesophageal reflux, which can be very bad for your lungs. That's it, nice and slow. 3-second pause at the top, keeping your airway open and relaxing, letting the air out. If you have a lot of secretions in your airways, doing the deep breathing exercises might make you feel them move and you might hear crackling noises, and it's very important to try and resist coughing at any point during the cycle and wait until the very end. So Sam, now that you've done 2 sets of 5, you're ready to try huffing. Huffing is a technique similar to a cough but much gentler. And we use huffing to move secretions much higher in your airways so that when you cough, you only need to shift them from the very top parts of your lungs and they can come out much more easily. Huffing uses an open O-shaped mouth, an open throat or upper airway, and you relax your upper chest and use your stomach muscles to push the air out. So it's kind of like fogging up a mirror like this. When you huff, it should never turn into a cough, because a cough causes your airways to spasm, uses a lot of energy and is counterproductive to what you're trying to achieve here. If you can, do at least 2 huffs and depending on where the secretions are, you might need to do a third or fourth one or so on before you do your cough to clear it. So try one huff for me. Good. Make more of an O shape with your mouth, and you can use a bit more effort from your stomach muscles to push the air out. Good. Huffing should never be wheezy. If it is wheezy, it means you're using too much effort and you're closing down your airways. So it should be that nice deep sound of air coming out with some crackles, which are the secretions moving. Okay, Sam, I'll get you to do one more huff. Good. Now let everything relax. Wait till the upper part of your chest isn't moving up and down and your breathing's nice and controlled. And then when you're ready, I would like you to take one big deep breath and have a nice strong cough. Good. So that is how you do one cycle of the active cycle of breathing techniques. Ideally in a session you would repeat this 3 or 4 times, or for 15 or 20 minutes, or until you feel your chest is clear. Make sure you always rest enough in between different components of the technique, and always rest if you start feeling lightheaded or dizzy or not right at any point during the cycle. Thank you.